Dirty Pop with Lance Bass
is live now.
Welcome back to Dirty Pop. I am your host, Lance Bass. This is Dirty Pop on Sirius XM's AlQ 106 and Stars 109. Drew Boo is with me today.
Hello there, sir.
Baby Ruth, Fortune Feemster.
Woohoo!
Ken Jerkman just left the studio. How
But
great
what's her
is she?
name? Ken Jerkman?
Ken Jerkman.
Did I say Ken Jerkman? I did not.
I think
Jen
you
Kirk.
did.
Oh my gosh, what is wrong? It is a Friday.
She can
It
be
is
a
a Friday.
Anything can happen.
She is a jerkman.
Ken Jerkman.
Jerkman. And right now, my next guest is a plastic surgeon and star on the E! Show Botched, which airs every Sunday at 9/8 Central. Dr. Paul Nassif, welcome back to Dirty Pop.
I tell you, I love being here.
Yeah.
Lance,
Yeah.
how come you keep getting better looking all the time?
Oh, please, because
Tell us what he's had done.
tell me what I've had
Is it
done.
because of
Paul.
that facelift I did on you 2
Yes,
weeks ago? That's
I
what it
know.
was.
I see him every 6 months for a little nip and tuck. It's really fun. It's really
A little nip, a little tuck.
I know. Trust me. I'm coming to you once I start needing it. Don't worry about that. Season 2 of Botched, which we freaking love this show. Like, did you think that Botched would be such a runaway hit?
You know, I got to tell you, I did not. We sat down, I think, a couple of years ago at BOA with the executive producers of The Housewives.
Yeah.
And we said, we got to do something. We got to really work on these, patients that really need our help. Absolutely no clue or no idea that it would actually come out to where we're at now.
Yeah.
I mean, people love this. It's especially, from the social media standpoint, people go crazy about this because, actually it's interesting. Botch now has, let's see, how many times on Twitter did it actually trend? Probably 5 or 6 times.
Yeah.
Pretty cool.
It is, and it's because it's fascinating stories too. Because not only is it fun to see, what people, can look like after you fix the situation, but it's their backgrounds that are just so intriguing.
Yeah, especially some of the things that you never expect what someone would do.
Yeah. What's the craziest story you had come through that maybe you didn't even work on?
Well, I mean, we'll talk about one recently. In the beginning of the season, we had Rajay. This is the lady who had cement pumped in her face and her body.
It's Brazil. Is she from Brazil? Where's that? Or Miami?
No. I don't know where she's from. I think she's local, but a sweet lady. She's a transgender. And I will tell you, ruined her face. But she's the sweetest lady in the world. And she actually talks, a little bit more of a, talking to other women about making sure that you are healthy and tact, especially when you have a problem like this. But that probably was one of the most severe things I've seen in a long time.
Wow. Well, season 2 of Botch starts April 24th, or started April 24th. For those who might have not seen the show yet, explain what you do on this show.
Okay, so it's Terry Dubrow and I, and we are revision plastic surgeons. I do the face, he does the body. I'm a facial plastic surgeon. We take patients that, first of all, did not know they can be fixed. And we see these patients, we hear their story, and if we can, we give them our help by revising something. Me, especially the nose or a face, or, Terry, boobs and tummy tucks. And we try to help them and transform something that is horrendous. And their stories, though, are incredible. Go down to Tijuana, and let's say you want to have a tummy tuck, you go down to Tijuana, and they put you on the table, and they take a big block of ice to anesthetize your stomach rather than anesthesia.
That's nuts.
Now that ice obviously kills your tissue, freezes it, then then it ruins it. Then what happens when it heals? You have your vagina pulled up next to your belly button. So these are the kind of things. Then we also have patients that come in that have had the worst things happen to them that we can't help, such as the cement or silicone in the face, or they want us to do these things that we don't do, like add a third nipple in the middle of their forehead, for example, things like that.
Yeah. You've had a nipple in the middle of the forehead?
No, I mean, that's one of our patients that come in.
That's the next
They
season.
go, can you put a nipple in the middle of my forehead?
Now, you and Terry Dubrow, have y'all worked? When did y'all meet? Did y'all meet because of being on Housewives? Or
No,
did y'all know each
absolutely
other
not.
before that?
No, actually, it's funny is Terry, that's the only show that he would watch of the Housewives was Beverly Hills, and he used to watch me, and because we're friends.
Yeah.
15 or 16 years I've known Terry. My mother introduced me to Terry. He did a little surgery on my sister, and they go, this guy's the most hilarious guy. Is a doctor the most hilarious guy? Which he is, if you watch him on TV.
Y'all both
You
are
know,
so great
I
together.
know.
Yeah, I
So
love
that's it.
y'all's dynamic. It's so great. Now, are there some people that can't be helped that come through your office?
Absolutely.
Yeah.
I mean, there's some people that either can't be helped because they're just, too far gone and we cannot do anything or it's too dangerous. Or there's some of the stories that are coming up that we don't get home runs. And we tell them up front that we might be able to get some improvement, but we do not give them any guarantee. And you will see them or see those stories upcoming in the season because it's all real.
Yeah.
Nothing's, it's straight live. It's exactly what happens. with a medical plastic surgery nightmare.
With transgenders like the new it thing, is it true that before you can work on someone that's doing the transition, do they have to go through a certain amount of psychological therapy first? Is that true?
Absolutely.
And then you have to get a couple of permissions, or like family members have to vouch for you, right?
Yeah, I don't really know the whole psychological aspect of it, but I do know they have to undergo an intense psychological screening, and before they can start doing the gender reassignment surgery.
Right. Now, in season 1, someone spent over $100,000 to look like Justin Bieber. I remember this episode.
Yes.
I mean, I've seen this guy in so many
my
different
gosh.
places. Now, what do you think about people having plastic surgery to look like celebrities? Is that a very common thing? It's kind of like when you go get your hair done. It's like, I want the Jennifer Lopez.
The Fortune Feimster.
Yeah, I want the Fortune Feimster. Do people say, I want my face to look like Diane Lane?
Yeah. Unfortunately, the answer is yes.
Yeah.
Now, is it routine? No. But patients will come in, I want this nose, I want these eyebrows, these eyes. And the answer usually is no, we don't do that. We want to actually take you, if you need it, and make you look better looking like yourself. But that does happen, and that's also on the shows you saw with the Justin Bieber lookalike, or trying to be a lookalike.
Yeah. Do you get nervous every time you go into surgery?
Absolutely not.
Yeah. Okay.
No
That's
way.
good to know.
Really?
You
That's
can't
good
get
to know.
nervous. No way.
You can't be nervous.
No, I don't care who it is and what you're doing, no matter how intense it is, you never get nervous.
Yeah. And are you constantly just watching your hands, so you don't, cut them or hurt them, or you don't do box? I mean, because your life really depends on your hands.
Well, when we used to hang out, especially when I was married, we were doing a lot of boxing then.
Yeah.
So we were doing a lot of boxing, and I still ski. I still do some things I probably should not be doing.
Wow.
Yeah, because if you injured your hand in such a way that you were unable to perform these surgeries, you would be done with this part
Absolutely.
of your life.
Are your hands
Absolutely.
insured like J-Lo's butt?
Oh my God! I mean, she does have a great butt.
$1 million butt. Yeah.
We have disability insurance,
Oh,
but
yeah.
does not nearly make up at all compared to what you would lose if you hurt your
Right.
hands.
Yeah, I can
Absolutely.
imagine. Yeah. Now, how do you determine which procedures you will or won't perform on a given patient?
Well, that's a good question. First of all, this is just a regular patient you're talking about?
Just regular.
Patient comes and says, evaluate my face. Let's say she's 53 years old. It's a she, for example. Evaluate everything. So we start, looking at the eyebrows, the eyes, the face, the neck, the cheeks, the whole bit. So we start looking to see really this is for a full rejuvenation, what they need, if they need it, and then we can kind of start discussing it. So sometimes when we do that, we do everything on the face. This is what we're talking about, just a extreme example of doing a complete facial rejuvenation. But they have to be healthy, undergo intense medical screening, cardiology. I also have them see a psychologist also to make sure they're the right, they're realistic and there's no problems with body dysmorphic disorder, things like that. So all that, psychologically, physically, realistic, the whole bit.
It's interesting because you mentioned body dysmorphic disorder, and I feel like I see so much of what I would, as a layman, I would diagnose so many people with that come out with these faces, the duck lips and the cheekbones that have been increased and the chins or whatever. I mean, I feel like that's such a result of plastic surgery, not all the time, but so often. So do you really turn people away?
So first of all, what you were talking about is not really body dysmorphic disorder. It's
Okay.
just bad plastic surgery.
Oh,
They
okay.
might think that having gigantic duck lips looks good.
Right.
BDD is more of someone that comes in, for example, that keeps whittling on the nose. And let's say they think it's too big, and then it keeps getting smaller, smaller, smaller until you
Michael
actually
Jackson
have no.
syndrome.
Okay. That's more of a BDD issue. And we probably turn away average about 10, 12% of our patients.
Oh, wow.
Absolutely.
Okay. So 1 in 10.
We're here with Dr. Paul Nassif. Now, look at Drew Boo here.
Yep.
What, if he came in for a consultation,
Oh, I'm glad we're not doing this on me.
what would you
Brand new face.
suggest?
But this below the chin is
Well, everyone
the
has
nightmare.
that. It
No,
is the worst.
Lance,
Yeah.
I didn't used to have it so bad.
So you'd have to get a chin implant.
No, I don't want a
It's
chin
not like
implant.
you
I
have
want
it's not like
somebody
your
to-
honey boo boo's mom. Calm down over there.
You don't have a June.
All right, so he hates his the
I hate
the
this
fat
thing.
underneath the chin. What would you suggest? A chin implant?
Well, no. That's actually the first thing I would say to him is, what's your weight? In other words, are you overweight right now? Are you 10, 15 pounds overweight?
Yeah, maybe.
So unless you've had it all the time. So otherwise say lose weight. If not, that's always been, they do a little liposuction, small incision. Running
Could you
the
freeze
chin.
that? You know that freezing thing is.
Yeah, you know what? There's actually a new product, and I'm blanking on the name.
Mhm.
It's injectable, and it's for that type of fat in the lower neck.
I've gotten it.
Do you know if it works?
Apparently, the FDA has approved it. So, and if that's pretty intense, so they that's probably going to work.
I
I want to get it done tomorrow.
I did get this shot underneath my chin. A friend of mine, is a plastic surgeon, and they filled it with like almost like a caffeine or something, like almost like a coffee shot. Have you heard of that?
No, this is a new product that's just got FDA approved. I don't know if that's what you're talking about.
Maybe, I don't know.
But I don't know, unless it was like mesotherapy or something.
I don't know. I just know there's like some kind of like caffeine or something. It's,
So my friend, she just got the injection thing. And now it's swelled up like this, but then once the swelling goes away, it'll be better.
All right, so
But
she
she
just
looks
got
like
it.
she's got a pillow underneath her
All right.
chin
Well,
right
that's
now.
a terrible angle.
So what? First of all, she looks like she's pulling her chin down to her chest.
Yeah.
But the other question is, what is the name of that down product? And actually, I talked to Nancy Grace about it too.
I might be able to find it for you.
It's of course a good old medical name.
What's the number one regret people do to their bodies that they can't take back? Is it the duck lips that are so permanent? A lot of people do the permanent eyeliner or the eyebrows. I'm like, well, what if in 20 years you want different eyebrows? They're permanent now.
Well, obviously that's that from a surgical standpoint. From what I hear, it's usually breasts.
Yeah.
That they go too big, cause a problem. Once they go too big, it actually starts causing problems with their breast tissue. Then after that, they need 2 or 3 revisions. That's the number one thing I hear.
Yeah. Interesting. Yeah.
Let's hit song number 5.
Oh my God! I forgot we have our countdown going on right now.
And that's why when I did this, I
I thought you were
know.
waving at me like,
I was
hi.
like, hi, Lance.
You're saying number 5.
Yes.
I got it now. Okay. We're going to
More
continue with Dr. Paul Nassif after this, but we have to get to our Dirty Pop Weekend playlist countdown because it is Friday. And in honor of Caitlyn Jenner, it's an all-female countdown for the weekend.
Yes.
It's going, yes. So we're going to start with number 5. It's Mizjan. Now, if you listened on Tuesday, this is from our new music listening party. We found this new girl from
Swedish.
Sweden.
Yeah.
Loving this song. It's Mizjan, If I Said I'm in Love, Suicide.
Number 5.
It'd be suicide if I said I'm in love.
Dirty Pop with Lance Bass.
Is live now.
Welcome back to Dirty Pop. I am your host, Lance Bass, here with Drew Boo, Baby Ruth, Fortune Feemster, Dr. Paul Nassif. Now, since Dr. Paul is here, we want to open up the phone line. So if you have any questions, plastic surgery, any kind of those, also start his new skincare line we're about to talk about. So any of those type of questions, call us 866-305-6887. We are here for you. All right, let's talk about your new skincare line. What's it called? Nassif MD.
Nassif MD Biorhythmic Skincare Line.
Love it. Now, that is very technical right there. Since you're a doctor, I'm sure y'all have. How long did it take you to come up with this?
So the ingredients in this, it took me 2 years to do this. And I went through every antioxidant, every DNA repair enzyme, and I found the best products that I can get. So just to give you a quick scenario with this, the biorhythms follows the circadian rhythm, and at night, you're basically repairing everything in your body, repairing your skin. So there's enzymes and peptides and antioxidants at night that really accelerate your healing while you sleep or not sleep. And then during the day, it's more of a protective phase from the oxidation from just being outside. But lastly, there's also something in it interesting called LipoShield. So when we're on the computer all day long and on the iPads and all that, that causes photoaging.
Oh, really?
So this little LipoShield blocks some of those, the UV, shall we say, not radiation per se, but there is a little bit of radiation from it, from screens like
So
that.
the UV lighting from the screen ages us?
Yeah.
I had no idea.
And that's in the blue wavelength, so it's interesting.
I had no idea.
And then there's an exfoliant, which is incredible
Now,
too.
do you feel like a scientist now? Because I'm sure you had to work with so many different scientists to even come up with this.
Lab.
Do you know everything about skincare now?
I've learned quite a bit about skincare.
Now you want to be a dermatologist?
No, absolutely not.
No.
But it is interesting because you're the guy that fixes the problems when people don't use good skincare protection. And so you're kind of cutting into your business, or maybe you're just finding a new angle to the business.
Not really, because what I do, let's say as a facial plastic, someone comes and wants a facelift. Now I'm lifting up the tissues of the face. So as I lift them up, I'm not really taking care of the outer skin, the little wrinkles. So I'm working on the inside, and this is where the void is. And now this will help work on the outside.
Got it.
So this is for wrinkles and blemishes and pores, things like that.
Nice. Where can everyone get these products? Because they're out now, right?
Yeah, they're out now. Right now, they're only on the website. That's all we'll offer them at now. NASFMDskincare.com.
All right. Don't
Thank
you have
you.
another? Do you have drpaulnassif.com too? Or is
Oh, yeah.
Okay.
That's my regular website,
All right.
drpaulnassif.com.
Sweet.
DR.
All right. All right. Now, did you always want to be a plastic surgeon? When did this come about?
I wanted to be a doctor probably since the age of about 11.
Yeah.
And then I was doing my head and neck surgery residency. I was going to get into something called neurootology, which is, ear, nose, and throat originally specialized, but then you deal with neurosurgeons and you operate on tumors that originate, near the nerve of hearing and the brain. So it's microscopic kind of brain surgery. That's what I was going to do. Until a little boy came in. He got bit by about 7 pit bulls. His face pretty much got torn apart. And I operated on him probably about 7 or 8 surgeries, and that's when I fell in love with facial plastic and reconstructive surgery.
Yeah. It must feel great that you don't have to work with dying people. I would say, as a doctor, at least you're bringing positivity to a lot of people's lives.
Yeah, with this, and just like on the show, you actually can transform someone's life in a positive way. Plus, it's fun for me. Operating is fun. I really enjoy it. So if you can do something that you really enjoy, you like, it's fun, and really help someone, then that's like a home run.
Now, are the extra difficult cases your favorite?
I love hard cases, yes. It's more challenging. And, for example, this year on season 2, these are the hardest cases that we have done in our career. And so, and by the way, you're doing something that 99% of doctors, 99.9% maybe, won't touch these patients because the risks are too high. So it's very challenging, it's exciting, and then it's exceptionally rewarding when the result comes out fantastic and the patient's happy.
And you talk about the risks being very high. Have you ever been bitten by that?
Oh, yeah. The point is you have something that does not heal well. Like when you're operating on tissue that may die or a portion of it may die. These things could happen, or you can injure a nerve.
And you've confronted things like that.
Oh, yeah. The point is luckily, we've been able to treat it early, if there is a complication. But every doctor that operates has complications. And if they say they don't have complications, then they're not operating.
Yeah. I remember, Janice Dickinson, when you worked on her, that you have to come across, I'm sure, a lot of patients like that don't listen to how to take care of themselves afterwards. She was like pulling wires out of her face.
What?
Yeah.
What do you do with that?
Yeah, she pulled a drain actually out of her breast.
Oh my
That's right.
gosh.
I remember that episode.
We deal with that all the time. So I sit down with my patients before, and I kind of, give them the, I basically say, listen, if I do this on you, here's what you have to do as part of a contract with me for me to touch you. But no matter what, it still happens.
Yeah.
They still don't listen sometimes.
That's great. What's the craziest patient you had? You don't have to say names or anything, but like, what was the situation, and why was it just like the worst experience for you?
Patient that we would misdiagnose and not discover that they're unrealistic. And I had a patient come in, and I did a fantastic rhinoplasty on that patient. And basically every day, because when you do a revision, it's swollen for quite a while. And we told the patient she's going to be swollen. It's going to take up to a good 2 years to heal. First 3 months, maybe 65%. And every day she drove us crazy about the swelling. And she'd come in the office just unannounced. She would call and berate, our staff. And then, when I would see her, she would, just not be realistic and just didn't listen to what I was saying. And that was probably the most traumatic thing in my career. And that was maybe about 7 or 8 years ago.
Yeah. Are there any cases?
And by the way, she did fine.
Oh, yeah.
Yeah, as soon as the 3 months hit,
Oh, really?
boom, that was it.
Are there any cases where you have a patient come in for maybe, breast augmentation, and then you found a serious problem like cancer, that type of stuff? Where you've like run into problems like that?
Few things. Actually, one thing I'm going to say to you, but I can't tell you everything, is one, you have to watch the show this year. There's something, you'll have to see that. That's all I'm going to say.
Oh.
Something like that.
Intrigued. All right.
It's very intriguing. It's actually, and it's all real, and it's raw, and it's incredible. But the answer is yes, especially since I do head and neck. And if I'm doing a facelift and I'm in the neck, if we see some weird lymph nodes, see something weird, we'll do a biopsy. Sometimes it can come back as lymphoma, found that. Or we diagnose things during our medical testing that someone probably would not have gotten for a year or so. And with the medical test, we discover something. So the answer is yes.
Yeah.
You know, how long have you been practicing plastic surgery?
15 years,
Okay.
15, 16 years.
So we're talking 1999, 2000. Plastic surgery then, and even especially before that, you know, it was this thing. It was a punchline on the late night shows. You know, that only Hollywood types would do this sort of thing, and plastic surgeons were sometimes looked as predatory, or that they were doing too much, or making people look goofy or whatever. Now it's changed. Middle America, people want to get a little lift here, a little tuck there.
It's all subtle now.
Oh, how do you feel about how things have changed and that people have really embraced it at a much wider level?
It has completely changed. I mean, especially now we have more males. We have women getting smaller procedures earlier, so it's not like all of a sudden of a change. It's nice and subtle, as Lance mentioned. Social media has also brought out, especially, you know, looking and doing, you know, you do these, what are the, you know, if you take a, you know, the selfie.
Mm-hmm.
Selfie, all of a sudden, if you look at your neck, you look at weird things like that, you start wanting plastic surgery.
Yeah.
But the answer is it has become so common, as long as, again, it's done for the right reason and you do the right thing. Middle America, everywhere you mentioned, everyone likes to get a little bit of a nip and tuck, as long as it's a healthy thing to do.
What's one of your favorite breakthroughs in plastic surgery in recent times? And is there something in the future that's coming out that you're excited about?
You know, I'm still always looking in the, you know, I use something called PRP, platelet-rich plasma, which has all these growth factors in it, and I use that in surgery, or I inject it in the face. And it helps stimulate collagen growth in your pores and helps fat cells live when you do fat grafting. So part of that, then the next, you know, evolution of it, again, is the stem cells. Now, that's something still a work in progress. So that is what I'm excited about, stem cells. What can it do for aesthetic surgery, but more importantly, what could it do for someone's health?
Where are we with stem cell research right now? Or we're still not allowed to research with stem cells, right, in America?
You know, no, they are doing some stem cell work, but again, depending on where they get it from, a very rich source of stem cells is just from the abdominal fat.
Oh, yeah.
So if you can harvest it from the stomach, you actually got a big, rich, you know, source of stem cells. So a lot of the universities are working heavily on it, especially in Europe, out of the country, Asia. They're all, you know, intensely working on stem cells for the next. For example, you got a cancer, you have something that. Or something that is happening really bad with you, whether it's in your bloodstream, whatever. They're working on new types of treatment which will eventually be stem cell directed to even eradicate cancer. You never know.
crazy.
This is still 10 years or so, 15, 20
But I
down the
think
line.
it is the key for giving us a very, very long life.
Yeah,
And
I
I'm
hope
excited
so.
to see what happens.
Best plastic surgery celebrity has to be what? Jane Fonda, maybe?
Oh,
She's had the best work
that's
done, maybe.
great.
Worst, maybe Mickey Rourke? What do you think?
I'll stick with the best, and then you can say the worst, then, if that's the case.
Okay, who's when you look at it, you go, that's damn good work.
You know, I got to tell you, there's more than Jane Fonda. There's so many celebrities that I know that age so gracefully and beautifully. They just look great. And they've all had work done, a lot of them. And it's the ones that just look good all the time, that look ageless. And again, Jane Fonda is one of them.
Well, I think
that's good
who's the
work.
model? I think because she's done like little
Cindy
subtle.
Crawford?
No, the other one. Older than that, she's 60 years old.
Cheryl.
No, she's from. She actually acts on Parks and Recreation. She plays the wife of.
Twiggy?
No.
Chrissy Brinkley?
Yeah.
Christy
No.
Brinkley.
No. No.
Yeah,
It's not
she's
Chris-
on
is it
Parks
Chrissy
and
Yeah, but
Brinkley?
Chrissy
Recreation.
Brinkley
Oh,
is
is that
about
Chrissy Brinkley?
that she's up there. I'm going to tell you,
It is
she's
Chrissy
beautiful
Brinkley.
still.
Yeah.
Yeah. I mean, just 60 years old, and it's just she looks 30.
I mean, she's got these nice cheeks.
Yeah. It's nice. Nice.
Yeah, I like her butt too.
There you know.
Oh, there you go.
All right, Dr. Paul Nassif, thank you so much for joining us once again. Watch new episodes of Botched every Sunday, 9, 8 Central on E. And for more info on his biorhythmic skincare or to examine possible plastic surgeries, visit his website, drpaulnassif.com. And then what's the
The
website?
skincare, nassifmdskincare.com.
All right, and follow Dr. Paul Nassif on Twitter, Instagram, at Dr. Paul Nassif, and on Facebook, at Dr. Paul S. Nassif. All
is
right. Okay, let's take a little break right here. We're not. We're going to go reveal the winner right now. Oh my gosh, we have the winner of the Dirty Pop Best of the Week poll. It's clip number 3. The Husbands with Paul Katami, Jeff Cirillo.
Nice day for a It's the Husbands on Dirty Pop Live.
Dirty Pop Live.
Look at David Whittemore.
All right, I sound gay. Whatever.
I mean,
it's the husband
it's the gayest
segment.
voiceover we have.
I'm so glad you said
any
it
of our
was you
statements.
Okay,
and
I'm
not
gonna
us.
butch it up next time. I'm gonna butch it up next time.
You should know that our
Husbands
friends listening.
on Dirty Pop Live. I mean, you are swishing so hard.
All right.
How many
S's in husbands?
I actually got a
nothing wrong
Facebook
with
message going, "Well, you sound really gay in that, Paul." I'm like, "It's not me. It's not me."
It's me.
It's May. There you go, David Whittemore. You won.
Congratulations, David Whittemore. You made the best of the
Best
week.
of the week. All right, let's get to our Dirty Pop Weekend Playlist Countdown. We are at number 4 today in honor of Caitlyn Jenner, an all-female countdown for the weekend. Number 4 is my new favorite from Sia. She redid California Dreaming for the San Andreas movie. And here it is. Sia, California Dream. Number 4 on Dirty Pop.
Number 4.